Good afternoon. Thank you, Mark, for organizing this event, and I will ask our distinguished panelists to come to the front. I haven't had an opportunity to meet all of them, so if I turn around to see somebody's name tag, then don't blame me. This is a very interesting conversation from the two panels that have gone on. This third panel is going to address the question, how can we stop the spread of HIV/AIDS in Black Houston? Our panelists, I don't know if Mr. Dixon is here. He's not here. Council member Etta Edwards is not here yet. We hope they can both join us. You met Dr. Foreman already. She has participated in the last two panels. And we also have Reverend Lawson, the pastor emeritus of Wheeler Avenue Baptist Church. Reverend Lawson needs no introduction to any community in Houston. We are so thankful that he continues to bring not only his presence but his wisdom to critical conversations like this. Next to Reverend Lawson is Reverend Joe Ratliff, Reverend Dr. Joe Ratliff. He also needs no introduction. In addition to his pastoral responsibility, he has been very active over the last several years in the training of pastors in his denomination, and moves constantly between Houston and the seminaries where those pastors are trained. We are so glad that he can join us this afternoon. Then is Marlene McNeese. Marlene McNeese is the bureau chief and works with HIV, STD illnesses in Houston, works with the Department of Health and Human Services, and she has done a number of things related to HIV/AIDS, served on numerous committees, and we are so glad that she is here this afternoon to speak. And then let me get our other panelist, Marisol Rodriguez. And she is here on behalf of Senator Rodney Ellis, for whom she works, but she speaks on her own right, her own knowledge, her own involvement, and her own involvement with this disease. So without further ado, we are going to begin the conversation. I might just ask, I do not know if any of our panelists is a physician, but something that we probably, and Dr. Lewis is still here, something that we haven't brought up is the current state of epidemiology and HIV/AIDS, current developments in therapies, and just what it is when we say HIV/AIDS is becoming a Black disease. We might just be looking at the statistics in Houston, but what really is the state of the epidemiology of AIDS before our panelists can start to talk about prevention? Where are we in terms of therapies? What works? What are the issues? What are the current debates in these conversations? And okay, yeah. So if you would excuse me, I think it might be nice to hear him say something like that before our panelists will start to talk. Maybe you can come here, Dr. Lewis.
I didn't actually bring all my statistics with me today, but I can give you some idea of how this disease is really impacting the African American community in the United States as a whole, as well as what are some of the current status of treatment of this disease. African Americans make up about 60%. I always remember that number because it's 60% of kids, 60% of adolescents, 60% of women, 60% of all AIDS cases, and 60% of the deaths. And that's why it's very easy to remember in a group of people that actually only make up 12% of the population. And with regards to therapy of HIV, we have made some significant strides. Still, and I will stress, the best thing is to not get it. So prevention is an area that still there needs to be a whole lot of work. There are about 40,000 new cases of AIDS in the United States every year. And unfortunately, that's been true for the last 4 or 5 years running. So that means that despite all of the TV commercials and all of the different kinds of media outlet things that we've tried to institute to change that, the fact of the matter is that the message is certainly not making a big impact on the number of new cases. As with specific regards to therapy, we do have what we call highly active antiretroviral therapy today. So for patients or for persons who learn that they are HIV positive, there is hope. It is not the immediate death sentence that it was even 5 or 6 years ago. With the advent of these types of therapies, protease inhibitor based usually, but there are these triple combinations, you may have referred to them as cocktails, the disease can be controlled. Now, when I say controlled, I don't want to minimize the fact that this is not easy therapy to take, that the therapy comes with its own set of side effects, and in persons who have comorbidities, there are certain numbers of these therapies that you cannot take. And if these therapies are taken incorrectly, they can lead to multi-drug resistant virus. You may have heard of a case in New York City that was highlighted simply because a person was infected with a multi-drug resistant virus de novo. In other words, he did not have HIV prior to getting this virus. But the reason that multi-drug resistant virus exists in the first place is because there have been patients who were exposed to medications in subtherapeutic amounts, and then the virus learned or was selected for that was actually resistant to these therapies. So although I can say with confidence that we have made significant strides in medicine in our ability to fight these diseases, the bottom line is that the virus, because of its uncanny ability to mutate, I call it really one of the perfect pathogens, still manages to outwit our therapies, as well as the therapies that we have being very, very difficult to take. I would say that the status of medical care for persons with HIV still has a very long way to go, but that there's certainly hope.
Let's follow that up now. And I want our panelists to reflect on prevention. In light of this information, there are two things about HIV/AIDS. I think, like you call it, the perfect pathogen. It is also the one type of infection where biomedical approaches actually, one would say, could claim that they have a higher ground because they've defined it as this particular kind of virus. On the other hand, there is also the whole question of human sexuality that surrounds HIV/AIDS. And so let's bracket those for a while: human sexuality, then the biomedical approaches, but ask our panelists to reflect on the social, political, educational, religious, theological dimensions of prevention strategies. And let's see, maybe we can ask them to, just pick up at as they feel that they can respond to. We might just start with you from the bottom, since you work with a state senator.
Thank you. We're talking about prevention on the state level. I'd like to share a little story with you before I go into the House bill. We were at the Houston Area Urban League, and we were there to promote chips for our young children that are out there. And I was standing there with Senator Ellis before the press were about to get there, and this gentleman says, "Oh, hi, Senator Ellis, I've written you a letter," which is very common for Senator Ellis from former people that are incarcerated. And I think he goes, "Senator, I really would like for you to try to work with us, for these people that have been formerly in prison." He's like, "I'm HIV positive, and I did not know I was HIV positive until I was released. And there are so many people in the state prisons that are either getting raped or having sex, and it is important that we get tested." So Senator Ellis stood there and was really touched by this, and he goes, "Mighty Soul, you guys start working on it and see what's going on the state level." So luckily, there was already a representative from Dallas by the name of Yvonne Davis who was already in the process for this past state legislation to pass legislation in order to have people that before they're released in state prison to get tested. And surprisingly enough, it got passed. So now we're in the process to see how is this going to be funded, how is this going to be worked out to avoid any constitutional rights, any kind of issues that are out there. But just to let you know, on the state level, that is what we're working on. And I do know that there is a gentleman from the Montrose Health Clinic that is interested in working with us on the state level to talk about what we're going to do afterwards, once they find out they're HIV positive, what they can do to stop the prevention and the spreading of HIV.
If I can follow that up, and any of you can speak, what is the relationship between what happens here in Houston at state level and then at the national level? Say, for instance, take an agency like the CDC.
That's a very good question, because like I said, this is like in the beginning of the process, and that was something that was addressed on the national level, with the Center of Disease Control. How are we going to be able to share that information? I mean, it is really in the beginning of the stages. I'm sure we're going to learn quite a bit come next year on what we're going to do to make sure that this process flows better.
Let's move on and maybe very specifically ask religious leaders, what is the community, maybe just the status, what are the religious communities doing to pursue efforts to stop the spread of HIV/AIDS? And both Reverend Lawson and Reverend Ratliff and Joe, I would like you to reflect on how this has impacted the theological education curriculum, if at all there is. Because if we are having, 40,000 new cases, theological education has to take note of that kind of an impact, because we're dealing with a very massive issue.
Well, historically, the church plays into that conspiracy of silence. We try to avoid this avoidance issue. And there are churches, as Al mentioned earlier, that are more aggressive and who have AIDS ministries, AIDS education, AIDS prevention. But those are unfortunately in the minority, because most of our churches see it, first of all, as a theological problem, because they still think it's a gay-related disease. It's not. No one else is involved in that. Of course, we know better now. Even with education, the awareness being raised, there's still the reluctance on that whole human sexuality piece. Mm-hmm. Those of us who are suburban, even on people talked this morning about the teenage pregnancies and all that. Well, we don't have that problem in the suburbs because we do abortions. Yeah. And so the reality of it is there's still sexual activity, but there's not. So that at every level there is that, if you will, a circumspect kind of way of approaching that sort of thing. So, but for those of us who are aggressive and assertive, in your face kind of piece, it's always interesting because from within we'll get resistance of people who said this is not out. We shouldn't talk about this. This is not what we ought to be about, even though the stats are clearly in our face, and many of our churches have increasing numbers of members who are affected by that.
Do you know of any seminaries now that have a course of instruction on HIV/AIDS where they bring well-qualified medical doctors and social scientists and so forth to address it?
Yes. In Atlanta, the ITC, Interdenominational Theological Center, does a cooperative piece with CDC naturalists right there in the same city. But so does Howard University. I'm just speaking of the black institutions. Yeah. Howard University in D.C. and also Morgan State. They've been on the forefront and been the recipients of the grant research pieces that are happening right now. There may be others, but those three I know of.
Yeah, thank you, Reverend Lawson.
I would certainly agree with Dr. Ratliff that we have been too silent about it, and it's somewhat significant that the mission of the church is to disclose truth. We are right now watching something that is historic, as a black woman lies in the Capitol Rotunda simply because she opened the nation's eyes to something that was very ugly and started the civil rights movement. It seems to me that the church at its best ought to be helping us to learn rather than hiding these things. We have not dealt very carefully with something which I think is a question in most of our minds. How could a disease that didn't exist when I started Wheeler Avenue Baptist Church have grown so fast and killed so many people, and now is moving so rapidly into the African American community? We are 12% of the population. The AIDS cases are 40% of the population. And there's just something strange about that. So I don't know whether or not there is some conspiracy that does need to be disclosed. But it seems to me if we're going to talk about prevention, we've got to talk about resources. And those resources are partly local and partly government. Obviously, we need to do some very serious things with our homes, but we need to also do some very serious things with our churches and with our seminaries, with our schools, with the media. And I think that there needs to be some very serious government money that is spent. After 9/11, we found from someplace $180 billion to spend.
Yeah.
There's no reason why we could not find the resources. So I think that if it is the church's job to disclose truth, then the church ought to help us to disclose the truth of what is happening with HIV/AIDS, whether it is just some bizarre medical accident or whether it is some kind of a conspiracy.
Thank you very much. I'll come back to both of you later, but let's ask Ms. Ward, what are some of the specific prevention programs that the city has?
To share with you, our program at the health department, we are called the Bureau of HIV STD Prevention, meaning we are an integrated bureau. The strategies we implement are to combat HIV as well as all STDs. So we fund organizations to do certain work, particularly community-based organizations. We believe in the experience and the expertise that community and faith organizations have within their own communities to teach and work with their own folks. We as a health department also do activities as well, but most of our work we contract out to organizations and faith communities. We are currently funding counseling and testing programs. We are funding programs that do health education. We also have mobile strategies where we are physically out in communities walking and talking up and down our local streets with individuals about these diseases and about preventive health messages. So there are a number of things that we do as a health department, but I do not believe that we will make any sort of an impact in this epidemic without involving our communities of faith. And without involving our community organizations who work and meet and talk and breathe and live with people every day.
I'll come back to that, but I think one question, we have two academic researchers on the panel, Dr. Foreman and Dr. Lichtenstein. How is HIV/AIDS part of the educational strategy of the university, or is there none, or is it something that is done by researchers alone who do their private research and publish and so forth? Is it part of the university in that sense?
Well, on most university campuses, that would be no, probably, on most campuses. In large part, it's individual researchers who have a concern or a passion for the area of HIV prevention and education. But, however, if you look at an organization like the United Negro College Fund Special Programs Division in Virginia, they actually have a panel of experts that they use to do HIV education at historically black colleges. And so many of your historically black colleges and universities do have some type of HIV education and prevention programs. Many universities have HIV 101. They're starting to implement that as an actual course that freshmen would have to take, and I'm a really big advocate of that. I think we need more programs like the United Negro College Fund's, programs, largely on historically black colleges. And, being at the University of Houston here and as well as being at Texas Southern, I can kind of see both perspectives. We do have opportunities on campus to do that. Probably maybe 3 weeks ago, I did something on STD prevention for the incoming freshmen. Right. But that's again, the individual faculty who are interested in that. So it varies from university to university, but if I had to say, give you a percentage of the universities around the country that are focusing on HIV information, education, and prevention and awareness, that's probably 15% out of the entire population that really dedicate funds, dedicate resources, dedicate people to that. And largely those are going to be your HBCUs, your historically black colleges and universities, because that's where they see the problem more so. We're faced with it in our communities more so. So your historically black colleges are going to be more likely to see that that's a need and try to fill that gap.
Dr. Lichtenstein, do you?
I'm encouraged that anybody is doing that. I think it's great that the HBCs are doing that. Oh, sorry. Thank you. Personally, I work alone at my university. I think I'm the only person who does what I do, and as far as I'm aware, I'm the only person in Alabama. So I think people who do research on this are a very small number. And I would be concerned about having a pipeline from the knowledge generators, which I guess I could call myself, to the people on the ground, the peer educators or the AIDS educators, who really sort of need the knowledge that people like me are generating, so that they know where to focus their efforts and what to say. What is the nature of the epidemic? How do we get that from point A to point B? And I don't know what the answer to that is. I'm glad there's an HIV 101. I wish it were everywhere, and maybe that's a start.
The reason I pose that question is because I'm very familiar with the African context. One could probably claim that HIV/AIDS is probably one of the most studied diseases in human history. Epidemics the kind of research that is done in Africa, sometimes one has the feeling, although as an academic I would promote research first, but one also has the feeling that it doesn't really get to the people. There's research on sexual behavior, on social institutions that promote HIV/AIDS, but sometimes one has to have the feeling that it probably doesn't go to where it should go. Every 2 years, UNAIDS, and UNAIDS has been wonderful, don't misunderstand me, organizing these huge international conferences where experts go. Now, as community leaders, what can we do to bridge that gap?
I'll share one of the things we're doing as a health department. Fairly soon, we're planning on bringing together representatives who are doing local research, meaning some faculty from the School of Public Health. Actually, Amanda Turner is charged with organizing that day, but for lack of a better word, I think we're calling it Data Day or Data Sharing Day. But we're bringing local researchers to meet and talk and share with local advocates, peer educators, and community and faith organizations to talk about what research is going on, as well as sharing with the researchers what things they're seeing on the ground. From what we know, I believe it'll be the first time we've had a session like that planned, and where we really want to bridge that gap that I think that you're talking about.
Yeah, Amanda, do you want to say a little bit more about that?
No, I think Marlene maybe more. She said it all. But just going back, it is our first time in Houston to pull this together, because what we want to see is like get all of the information, because different universities are doing different type research, and we want to share research because we are all part of the Houston HIV prevention community planning group. I am a member, Marlene, and also Barbara, the CPG which we meet on a monthly basis. And that's one thing that we really want to do, because it's a lot of research been in which we have not seen that research. So, and really for the universities and the City of Houston Health Department and the CPG is to collaborate and work together. And that way the CPG can move forward as to developing their comprehensive plan for the city.
Thank you. Let me go back.
Can I add one thing
yes.
before we go off of that? I think where you see the disconnect, which is what you're talking about between researchers, is that, especially on a university environment, you have to always remember that it's really, it takes a long time to do implementation research, and so most researchers do not do implementation research because we are under publish or perish kind of guidelines.
Right.
And I mean, I'm going to tell you how it is. I don't sugarcoat it, but any kind of academician will tell you that, and you know yourself, that it's hard to get funded for implementation research because it takes a long time for you to turn it around. And those of us, once we do our work, we publish in journals, and those journals are not read by people in the community that we need to affect. So that's where the disconnect goes. And if we don't go out into forums like this and present our work in a non-clinical way. I have slides that I use for clinicians, and I have slides that I use when I'm talking to lay people to explain the physiology and the chemistry of it. So I think that's where that disconnect is. If you're, the researcher has to be a practitioner. You have to be a public health practitioner really to really make sure that your work is then translatable into usable interventions in the community, because otherwise you're sitting in the ivory tower at the university and your job is to publish and publish in journals where our clients are not reading those journals, and our target, the people who need it don't read those journals.
This leads me to ask a question, because I'm very much concerned that we do a lot of this academically, and if you're at-risk group are the 12 and 13-year-olders who are already starting to become sexually active, and they are most often low-income people and people who do not have very much education, very much sophistication. How do you reach them? And you certainly can't reach them with research they do have to be reached. And this is where I think churches, if Joe, we could wake up, I think that they could help. I certainly think that certain things could be helped through the media, but I think that somehow we need to reach that low-income 13-year-old who is never going to look at a manual.
Thank you very much. Before we go on, I just need to welcome Council Member Etta Edwards. She's joined us, and we're glad you are here this morning. And when she gets her stuff together, then we'll ask her to comment. Let me go back and ask this question of religious communities, the state, the national government working together. When the president took over office, he instituted this policy that he was going to work with faith-based organizations. I mean, it was a very controversial policy, as many of you know, very devastating, even with the 15 billion he has promised for AIDS in Africa. Because of that policy, it's made it very difficult to carry on HIV/AIDS prevention in Africa because of the stipulation. Have any of you given thought of bringing city leaders, religious groups, to just sort of look at this in the face, not do just a town hall meeting and come up with some strategy? Because like Mandela said, we are fighting a major war that is probably going to take more people than all the wars that have been fought in the 20th century. Have you given any thought, or you have any ideas what we can do to really bring public health, this is really what we're dealing with, and the communities that actually have the loyalty of the people together in a very aggressive way?
I frankly want to commend the people who put this together. This is Rice University, where there was a time when folks our color couldn't even come into this place. Mm-hmm. And you were having not only a conference, but a conference that deals with something like HIV/AIDS. So to Mark Little and to all the folks who worked with him, congratulations. This is great. And this is at least a good beginning. I think some kind of public forums like this will help.
Thank you. Joe.
Yeah. I think the faith-based initiative piece, though, is not only controversial, but suspect and untrusted, and I'm not sure how we can overcome that to, we might could package it differently. We could get the money and do it some other kind of way, Bill. But so many but I think for the most part, there's so much suspicion of the agenda of that group. And those dollars, and they can be, manipulated and worked so that I think that these kinds of things can happen, and we've done that in other areas. So I think for sure with the HIV piece, we can do that.
Councilman Edwards.
Thank you, and I apologize for being late. I was at another event, but I think that for any kind of project to work, there has to be a program, a process. There is no public health program in this city, in this state. There are public health screenings that go on from time to time, but there's no ongoing public health initiatives that people are really aware of what's happening in their community. You go from testing site to testing site, but there's nothing in between the testing. And so one of the initiatives that the state of emergency had been trying to do was not waiting for events to happen, but to take public health to where people are, to the apartment complexes, to the shopping malls, to where people are, and then trying to get at least some stakeholders in that community to be the gatekeepers. I think that when we try to just have public health through to screenings, then we're playing. We're not addressing anything. That's just telling you what the results are. It's not dealing with how people are getting there. Why is a 13-year-old sexually active? Why is a 10-year-old sexually active? Who is that? Why is a 10-year-old even more sexually active with a grown male she's not usually active with a 10-year-old boy.
Right.
It's usually, so there are more things that we're looking at as opposed to just going and getting someone tested. And I think we've tried to use testing as our public health program, and that's not a program. Mm-hmm. That's a part and piece of it. And until we get it, until we understand, there are some countries that have a real a handle on this, where the public health officials live in the communities in which they work in. Mm-hmm. Mm-hmm. They have to live in those communities. And so people get a one-to-one. Not only do I see you when I'm testing you, I see you at the grocery store, I see you at the wherever, in the community. And we have to look at public health differently in this country, as opposed to a screening process. Screening is one part of it, but it's not the whole of it. And that's basically all we do now in public health, is screen people for diseases or for problems. Yeah, but we don't give any day-to-day as to, if I tell you to stop drinking Coca-Cola, how do I help you start drinking something else? What am I replacing? I mean, we have to give people something other to do than to just say no. That is not a public health program.
Very good. I want to go pick up something, and I'm glad Dr. Lewis is still here. I can't give you statistics, but if there is some sort of connection between mental health and the number of people in our community that we are seeing come down with HIV/AIDS, do you have some reflections on what we can do? Because it's sad to say, it seems to me like Houston probably has one of the worst mental health care in the country. I mean, can any of you speak to that? And
Sir, I would like to address that.
Yeah.
I'm not a mental health doctor or any kind of doctor, but I do know if AIDS was the only problem in the African American community as far as health issues are concerned, we'd be in good shape. But we are on the top of the list with all of them. I know people who have breast cancer who don't go to the doctor until they get an ulcer so large in their breast that they've been stuffing with gauze. So there's an attitude. There is a health issue, a mental health issue, if you will. That there's a pathology, I'll just leave it at that, in our community that says that we don't talk about health. We say, I got sugar because my mama had sugar, or whatever. There's an attitude that we are not, all we do is screen for health. We don't talk about it. We don't talk about mental health in our community. We say, well, that's just the way Marlene is. You know, and so there is that connection, and I think that it not only affects why we're at the top of the list with HIV, but also at the top of the list with high blood pressure, prostate cancer, diabetes, and a lot of other things. It's how we look at our situation has a lot to do with how we're socialized in this country.
And if I can add, while Dr. Lewis is getting ready, Ada mentioned something a minute ago about there are other countries who have a better handle on it than we do. We've watched other states actually have a better handle on it than we do here in Texas. We are part of a coalition. I mean, as a health department and as a city of Houston, there are actually 6 cities who work directly with the Centers for Disease Control around HIV because we have the highest infection rates. We get together and sort of do peer-to-peer types of technical assistance. I mean, we each talk about some of the programs and strategies that we employ and that are working. And clearly, you know, each and every time we meet, and that's 4 times a year, Houston is sort of like the little brother listening to all the great things that are happening in other states. New York, I mean, places where you would imagine. But what has occurred in those communities is that they have had a complete unifying acknowledgement between government, between faith, between local advocates, that this is a problem. Number one, they have bonded together and said it's a problem that we must address. And number two, the strategies that they employ address health overall. They're not specific to one aspect of an individual. They talk about addressing needs of human beings, and those are the strategies that we've watched work. But we here in Texas have legislative mandates that prohibit many of the things that we know to work. You know, I'll step out on a limb and talk about syringe exchange programs. Syringe exchange programs have been proven over and over again that they work. They stop the spread of disease, and not only do they not promote substance abuse to continue, but when worked with other programs and other entities in a holistic approach to treat the whole person, they have actually proven to reduce the rates of substance use in populations that once used. So, but Texas legislative mandates prohibit us from doing so. So we've definitely got to work with progressive elected leaders like Councilmember Edwards and our Representative Ellis. You know, thank God we have some of these people in office today.
Yes, Dr. Lewis.
I would actually applaud what you just said. I've asked that question many times. I mean, how many people do really need to die before we get needle exchange and condoms in prison?
Yeah.
But to your question with regards to mental health, as I said earlier on the panel, mental health and HIV are inextricably bound. About 60% of patients that are diagnosed with HIV, and I would argue in my clinic it's much higher than that, are also suffer with some degree of mental illness. It makes sense in a way that HIV can cause depression. It's sort of a natural, if you will, progression if you think about the ramifications and stigmas and so forth that are attached to the disease. But it is also true that depression causes HIV. And the reason why is because someone with no self-esteem is more likely to go out and sell their body. Someone without the social skills, if you will, or without a firm grasp on reality is more likely to be taken advantage of, and hence HIV. So it's really a two-way street that HIV causes some depression and certainly some affective disorders, and then likewise those contribute to the burden of HIV within a population. I think that the last thing I would say about mental health is that we describe HIV as being a highly stigmatized disease because of the gay thing or the homosexual thing or the sex thing or whatever that makes it taboo to talk about. But I don't think there's anything else that rivals the idea of mental health when it comes to stigma. Patients that I have would much rather know that they have HIV than to know that they're dealing with a mental health disorders. Particularly in the African American community, I've noticed that is just not accepted. You cannot say that I'm crazy. But you know, and I'm not talking about Marlene specifically, but I think the real problem is that we have not given ourselves permission to really openly, honestly search at that truth that these conditions exist. We need to learn more about them, and then we need to actually do something about them because, like HIV, there are very good therapies that can help restore that sense of well-being, that sense of having a life that's worthwhile, that you have something that's worth living for, and reconnect patients to reality. That's a very tenuous, we take it for granted, you know, we really do, but there's a very tenuous connection to sanity. And we really must recognize that.
Thank you very much. Yes.
Can I jump back to a comment that
Sure.
Marlene made earlier? Marlene, you talked about UCHAPS, which is that coalition of cities who have high rates of incidence in regard to HIV and AIDS. Can you tell us the names of those cities and also share with us, if you know, how much each of those city governments contribute to the fight against AIDS, and then what our city government is doing in regards to that funding?
Yes, the 6 cities include New York, Philadelphia, Chicago, Houston, San Francisco, and Los Angeles, California. Each one of those cities, obviously New York and San Francisco are sort of the outliers in terms of the amount of money they receive from the Centers for Disease Control. Their population, their epidemic, is about 3 times the size of ours. So they are in the hundreds of millions of dollars in terms of resources that they have from government funding. San Francisco is the same. The rest of us sort of fall fairly close to one another. We each receive anywhere between $4 million to $7 million from CDC. Each one of those jurisdictions receives almost an exact or close to an exact matching in terms of dollars from their local governments. Meaning local government has said we commit just as much to fighting the epidemic as the CDC does. And so Houston is the only one, when compared to that fact, has it's minuscule in terms of what our local government puts into the epidemic versus what CDC does here in Houston. I will add, though, that the money that has been put toward fighting HIV in the city of Houston has really come through the work of individuals fighting for that behalf, like Ada Edwards. And if she really wants to add anything around that, I'll just sit back and let her. But if it were not for her work on city council during her tenure, we definitely would not have what we have today. So, yeah.
I would just like to add to Marlene's statement. One of the things that needs to happen, when you have city council persons that sit on city council today and can look me in the eye and tell me they're not sure that they think everyone has a right to health care, we've got a problem. Mm-hmm. And there are several city council persons that have that type of attitude, not only necessarily about HIV, but about public health issues, period. And so that's the first piece, that you got to know who you're voting for and what is their position on those issues. The other piece is that when you have the state of emergency task force, those people work night and day, volunteer, doing things that should be done on a for-pay basis. You cannot expect for someone to work an 8-hour job, take care of family, and then give you 24 hours, a day also volunteering. And the type of work that will get any type of handle on HIV is a 24/7 job. It's not 8 to 5. We cannot stop HIV sitting at a desk on the computer and going to conferences. We need to be in the streets talking with people and helping people go through, like Dr. Lewis was speaking of. Right. The issue of self-esteem in our community. How many of you know people who are diabetic that don't take their medicine or eat whatever they want? It's the same thing. Yeah. It is the same exact thing. And what Dr. Lewis is talking about, those are issues that we've never addressed in our community. Until we start addressing them in that context, we will always have some type of ailment that we're talking about. The issue with money for the city of Houston is based on you guys, the voters of the city of Houston. You have got to let people know that it is well and good if we're going to spend 80%, if we can stand up and say we're going to spend 80+% of our city budget on police and fire, what are we going to commit and dedicate to public health? We make those commitments all the time, but when it comes to public health, we go like, well, we catch it as you can, you got insurance. No, we don't have insurance. There's no correlation between the state. When they took out CHIPS, then that brings us down even further. With the Katrina, our brothers and sisters from Louisiana, after the 6 months of FEMA help in that area, the social services are going to be so overwhelmed with people that we're just getting by in Louisiana. They'll be just getting by here in Houston, Texas, and that that cycle is just going to get bigger and broader. So as far as money's concerned, it's on you, boo. It's how much are you willing to make your people accountable from the state level and the federal level and the city level and the county level. We can't just let people just decide that we're not going to do that. And especially when we're talking about our young children, we've got to go in. HISD needs to be spending money on HIV prevention. Mm-hmm. A lot of sexual activity that goes on in grammar school bathrooms, I don't know if it was surprising of you in this room, but I know it surprises a lot of mamas and daddies when I talk to them about it. They need to be giving some money to help this war on HIV prevention. And if they don't want to give the money, they need to at least give us the access to the young people so that we can talk to them and tell the children the truth about what is happening. And yeah, you can, if oral sex is the new latest thing for the 5th grader, you can still transmit HIV through oral sex. And that's what's going on in a lot of 5th grades and 4th grades in Houston, Texas.
Before we open it up, I have kind of a tough question, mostly for our religious leaders. Have both of you reflected on the controversy between, in Africa it is ABC, and the whole debate on condoms? There are all kinds of excuses, there are all kinds of reasons why people don't take them. Africa has a prevalence, or put it roughly, more than 25 million people now live with HIV/AIDS in Africa. So just suppose condoms worked only 10% or 20% or 50%. That will be probably 12 million people less living. What conversation do you have amongst yourselves as religious leaders? Because what really is objectionable about a material product that has been manufactured for somebody to wear to protect semen from going from the man to the woman? I mean, have religious leaders thought, what is the conversation among Houston ministers?
Well, I think, first of all, we have problems dealing with the reality of the sexual activity. I mean, that's our first problem, that we can't admit that those statements like Ada just made, would baffle most of my colleagues, that the grammar school is dealing with oral or sexual activity.
Not my child.
That's right, not my child. Mm-hmm. So that's our first problem. And the second is that I don't think the church has dealt with human sexuality, period. That's more getting into homosexuality, then talk about condoms. We're clear that most folk buy condoms, they just don't use them. Fellas have them in their wallets, and they have a circle on their wallets, imprints, because that same condom been there. Mm-hmm. And they show, I got one, but they're not putting it on. So the lack of education, first of all, about sexual activity, but then also just the common sense use of that. There's no objection to condom. We can't get to that discussion because we can't get past the whole idea of what Dr. Foreman was talking about earlier. Mm-hmm. What do we know about our bodies? Yeah. And our kids know about what they're doing, and they don't.
Let me, one question I was going to ask again, Marisol, at the state level, besides legislation, does the state of Texas have any large task force?
They do have a health task force, but as far as HIV, I'm not aware of one, to be honest with you. Yeah. And this is the good thing about going to these events, is because I can bring this information back to my district director, bring this information back to Senator Ellis, and say, okay, this is something that we've missed. This is something that we need to start to do. This is something that we need to start working on.
Mm-hmm. Thank you. Yes.
One of the things that I was going to add too, and I can't speak, my pastor was supposed to be here today and he's not here, Remus Wright from Fountain of Praise. Mm-hmm. And talk to him about, no, I'm just teasing. He did have a really good reason that he couldn't be here. But one thing that I wanted to say and make available, I think, to our faith-based institutions, which we're all, it's a very important institution in our communities, and we rely on that, is to make ourselves available to them as the people who are the educators, and being available to the faith-based institutions to work with them. Some of that faith-based money and that absence-only money that many of us would not touch. Me personally, I wouldn't touch the money, but if I could work with a community like a faith-based institution to get the money, we know how to get the money, we know how to manipulate it such that we can teach and we can use that money in such a manner that it would impact our communities. The other thing that I wanted to add is that even though, parents will say, no, not my child, and I can give you an example of movie theaters. How many of you have teenagers? I don't have any children, but you have teenagers and you drop them off at the movie theaters. This would just shock a lot of people to know that you drop your 15-year-old off and you think she's going to, have watch the movie. And what's being very popular, even in some of the most exclusive areas here in Houston, are people having oral sex in the movie theater when you're dropping them off to see a movie. And they're sitting in the top part, the dark parts of the balcony, and these are the kinds of things that are going on. So I agree with Reverend Ratliff that if we have to have that discussion early. It's how we are socializing not only boys and girls, but to have that discussion very early. And as a sex educator, there is always an age-appropriate discussion about sexuality. So you don't have to wait till 12 years old to discuss sexuality. See, people think sexuality is sex. That's a small, minute part of sexuality. And so if we can't have that conversation with the 2-year-old about this is my body, this is who touches it. I mean, there's appropriate sexuality of education at every age. And I think that's what we don't know. And a lot of parents don't know it. So the parents can't teach. You can't teach what you don't know.
Yeah.
So I think that has to happen. And I know that many of us in this room I know that I would be willing to work with any faith-based organization on any type of what we can do within our own churches just on sexuality as so that we are healthy individuals just across the board, regardless of HIV or teen pregnancy or whatever.
Councilmember Edwards has a point before we open it for your questions.
I don't think it should just be on the onus of the church to deal with sexuality. I'm a big proponent of the theory that the largest sex organ is your mind. And most young people who get involved in sex in a very young age has nothing to do with their sex organs. It has to do with their feelings of self-worth, has to do with their feelings of a need in their life. They're trying to feel something in their life. And the problems that I think that churches, when they think they have to talk about sex, it's not about talking about sex, it's talking about being a human being. And how do you learn how to be a human person? And that sex is a part of your humanity, but it's not the whole. But if that's the only thing that gets you any type of recognition or gets you any type of response or gets you any type of touching from somebody, then that's where people go. But I think that sex is, for most people, if you're honest with yourself, sex is in your head. I mean, it really is. And sometimes you have to make that effort to make it go to a physical thing. But, and for our children, and when you talk to young children about sex, that's not what they're talking about.
Even thinking about that.
They're talking about the needs that outside of sex, the need to be held, the need to feel like somebody cares about them, the need to feel like they are worthy of something. And so I think if we can get churches to appreciate that when we're talking with our children about their sexuality, as the young lady said, it's not about sex. It's about those needs and those emotions that you have, and they're just trying to find some way to get those needs and emotions dealt with. The other issue regarding legislation on the state part, I had a real problem with the latest legislation that was passed. And I think it was passed in good spirit, but because there was no connection if they want to do something mandatory in the state regarding inmates, test them when they go in.
Yeah.
And make it mandatory that they have sexual education or sexual awareness in that prison, and give them condoms. If you want to do something mandatory, give them condoms. We know sex goes on in prisons. And we know how HIV is transmitted. And for you to tell me that you're going to test them on their way out when they've already been infected, and then not to give people like Judith Momoh and Marlene and Dr. Lewis the money to deal with them once they get out, what are you telling me?
Yeah.
We just got more problems. So I think that if the churches would understand, one, that this is a community problem, we have to work all together. And when we're talking to our children about HIV and sexuality, it's more about being a person than it is about having an orgasm or a climax or anything. Because half of them, they don't even know what you're talking about when you talk. It wasn't nothing, but it's like I felt like I was somebody big, or I felt like I was important to him or to her. Not that the act felt any, but it's what they felt like, what it meant for them up here and in here.
Right.
So I really appreciate the work that these two gentlemen have done, but we have a long way to go.
Right.
And it's not just Shaquita and Riri. It's the little girls that's been singing in the choir on Sunday mornings. And I'm not, you know what I'm saying? We try to say it's those kids, that little fast girl over there. It's all of our children that are being inundated from the foods that we eat that are so inoculated with hormones and so forth. These kids don't know what's going on in their bodies. We don't talk about their bodies anymore. We don't allow them to talk about it, so they let Puff Daddy talk about it, or whoever talk about it.
Yeah.
And so I really appreciate what's being done here today. And I think we can win this thing. I know we can. It's just, we just got to have a made-up mind to do it. Amana, that's all we got to do is just
Thank
make
you
up
very
our
much.
mind.
First, Judith, and then we'll go to you. Yeah.
I was privileged to be at the UNAIDS conference this year. I was invited to be part of the discussion. So one thing that I learned from one of my colleagues in Africa is not only the ABC, but there is the D part of it now, which Sister Ada was talking about, discipline. So that has to be part of the A, B, C, and D. Because if you really discipline up here, then you can control the other parts of your body.
Thank you.
I mean, you don't let the little head think for the big head. That's what is really leading people astray. And one thing that I have to ask, because we have our leaders here, I've been in this country for 30 years. When I came here, the African American population was 12%, and it is still 12%. So what is happening? We have a lot of blacks coming from all over the world. What is happening to all of us? Because my number is not counted in your numbers. And if we really want to reach the population and have the piece of the pie that is supposed to be in the community, we have to claim people who are part of that community. And until we start claiming our brothers and sisters who come from all over the world, the pie is going to remain the same. And then I go to Marlene, I said, I need money for the African and Caribbean community. And she's going to tell me the money is for African American community. So what is happening? Let us start preaching and practicing and going to ask that, hey, people are here, they came, we add everybody who looks like us because we're part of the problem. Let us lump in like every other group is doing and going for a bigger pie. And then we can donate to smaller chunks. So that's the issue that I want our leaders to start dealing with. And then the other one is the collaboration between communities. I know you talked about the religious money, but we're working with the institutions right now. And you're talking about implementing, because once you work with institutions, then you as a CBO can go there and implement, because we are all working together. But let us stretch more and stop, putting these barriers, talking about CBOs and faith-based. We all belong to churches. We all are in the same thing. So when the monies come, let's not take it personal. Let us use it to the benefit of our communities. Because once we all start working together and really putting our efforts together, then we will see the impact of HIV. Sometimes you hear my accent and you say, oh, well, she's from Africa. But I work in all the communities around here because it is my problem. HIV is my problem, not only because they said it started in Africa, which but just like I said, 6 hours away, you are in Africa. And whatever happens here, sexual mixing is going on, everything is going on, just like Sister said, the choir boys, choir girls, we are all supposed to look innocent, but we may be guilty. So let us stretch out of our convenient areas and go and touch other people, because if they're here, they may be having sex with your child. So just like they say, if I have TB right now, I'm in this community, I can breathe on you, and then you're gonna get it. So we have to reach out and really, really incorporate whatever we're doing.
Thank you very much. Yeah.
I think she's absolutely correct. There does need to be fewer fences and barriers. And one of the things that has been said several times is how some of these programs are working fairly effectively in Africa, and they are not working that well here. There's probably at least one good reason for that. We set in our Constitution a separation of church and state, and so we have a barrier built into our law, and we need to break down that barrier. I don't mean we need to change our Constitution, but I think we need to work in terms of another word that I haven't heard here, coalition. We need to set up coalitions where the government and the education system and the medical community and the church community can be working together. There is money that can be gotten, and if we could put together some kind of a coalition, I think that we could have some good preventive programs. But we do have to get rid of those fences.
Thank you very much. Okay, maybe that, and then we can take one or two more questions and then wrap it up. Yes, go ahead. Yeah.
Yes, good evening. My name is Robin Bennett. I'm just an ordinary citizen. I have found the money, and I do have the money. I have not found the resource to help me with the AIDS and HIV. I have called upon my brothers and sisters. I had one lady to tell me, are you our competitor? I never thought a disease was a competitor. This is what I got in response. I went out, I bulked, I looked, there's millions of dollars there. And I found them, praise God. I'm community-based, but not community-based they want. I'm a community-based in God to help God's people. God's people have no color. God's people are people. And he says, help your people. Now, I need help to get this grant, to get to the people, so we can have that money, to go on the streets longer, to talk to that brother, not just that brother, to that person. Take away the word brother and put person there. That's what you're looking at, a face, and it has no color on it. Until we can put that aside, we can get on with business, and that's what I'm here for. I need help. I was told in Louisiana, when you need help, you ask for it. Now I'm asking for it. Can anybody help me? These people are waiting on me, and I need somebody to step with me. Thank you.
Thank you. Yes.
I want to say something really quick before I pass it on to the person here. I personally just want to thank the two reverends up here because I was raised Catholic as a Hispanic male, and I recently was asked to talk at another university here in Houston, University of Saint something, and they asked me to talk to a group of college kids, I'm going to stand up to say this so I don't fall over, about being a gay man living with AIDS. And I went into this college classroom, and I was talking to these students, and they had a Catholic priest in the classroom. And he raised his hand, and he said to me, he says, what do you think about the Bible saying that you're an abomination and you're going to burn in hell? In front of all of these students and all that. And I says, well, I was raised Catholic, but I no longer belong to that because everybody there seems to miss the one key word in the Bible says, thou shalt not judge. There is only one judge. And I just want to say that you guys represent that 100% today, and I applaud you for being here. Thank you.
Yes.
And I just wanted to say there are several coalitions that are here in the Houston area. We just need to start working together. Seems to me that when we form coalitions and we try to do the things that we know we need to do, there's always that piece that keep us from coming together because it's a money thing. if you know, if one person or one entity feels like they're going to get some money, then they don't want to help the other person. So that's a big problem. But the state of emergency is a coalition that is absolutely working, because there are several organizations that do HIV/AIDS work, and they're always willing to help. And we do go out in the middle of the night when we don't get paid. And we've been doing that for many, many years. We've done that for, I don't know, Ada, help me here, 5, 6 years. Yeah, some of us, like I've said before, I've been out here 20 years, so we are here, and we don't mind helping people. I don't have nothing that I'm worried about you taking from me. So what I'm saying is that if a coalition, there are many of them, you just got to get there and stick with it, and don't always think that somebody's trying to stab you in the back, because they're not always.
Okay, one comment, and then we have 3 questions down here. Yes.
Okay, I also want to applaud the pastors. I'm a part of St. John's downtown. We do HIV testing every 4th Sunday at our church, and I think that's just wonderful. And we go before the congregation and give the local and nationwide statistics every quarter. So our congregation, we're reaching 9,000 people in our congregation, and I just want to applaud our pastor for that. And just to say, as we talk to youth, what I've been most devastated about was when I said, well, did you ever think that did you want to grow up to be a drug dealer? Because we have some little kids that claim to be drug dealers in high school. Mm-hmm. And one guy told me, yes, because my dad is a drug dealer. Mm-hmm. So we have all education can't be at home. That's all I want to say. He said, yes, because my daddy is a drug dealer and he's a gang member. When he get out, we're going to join a gang. So sometimes it takes us at the church and at home to come together also and be partners in trying to help stop the spread of AIDS among the next generation.
Thank you very much. Yes, we have, okay, let's begin with the young lady here.
Hi, my name is Marissa Mumphrey, and I'm a senior pre-med art history student here at Rice University. And I guess my question is more towards Mrs. Rodriguez and Mrs. Ward. I know the art community is a very big community here in Houston, and I know there's several artists who do work with prisoners and with drawing pictures and having seeing the physical virus. I know there's a Dr. Eric Avery out of UTMB Galveston. He's an artist and a doctor as well, and part of his work is going out into the community and showing people this is what the actual virus looks like, and showing, he makes booklets from paper that he makes himself, showing prisoners this is what the actual AIDS virus is. And I was wondering if your organizations worked with any local artists or anything, because I know that they have direct contact with the community and could be helpful.
I know I can share that there was an art fundraiser that a local artist put together. You remember her name, Art for Life? Alicia Minor worked with a lot of the organizations that are part of the State of Emergency Task Force to actually help bring the educational pieces together to this art show that turned out to be a fundraiser that benefited these organizations who go back out and work with people who are living with the disease, or even helping those to not get it. So there has been a recent push to start working with members of that particular community. I know in working with young people, Dr. Lewis didn't mention it earlier, but when you look at not just HIV, but also STD rates in the city of Houston, 79% of all of our chlamydia and gonorrhea cases are among 15 to 24-year-olds in Houston. Mm-hmm. Our STD rates, and so they're becoming infected with the virus. They may not show up in our HIV numbers until they're 25 or 30, but they're getting infected because we're seeing other sexually transmitted diseases that we can detect earlier show up in those young people. So when we work with them, many of them talk about, I think a young lady mentioned it earlier, a need to see the virus, a need to see the ramifications. It's something very visual and graphic about our culture and our society today. Our young people just don't get it until they see it. At least that's what they've shared. And so we're hoping to do more of that type of work with the art community. I think they would help. We used to actually have those types of things many, many years ago, and somewhere it stopped. I guess funding cuts might have had something to do with that.
Okay, yes, the second question.
My name is Kaishan, and I'm a senior at Rice too, and I've learned a lot just coming from this, and I'm interested in public health, and a lot of these things I didn't know before. But what kind of advice for the typical like American, or let's say college student, who kind of is aware of a problem and they're interested in helping out? What can they do? Like, you can talk a lot about like peer education, but, or is it money, or is it knowledge? But like knowledge doesn't change behavior necessarily. So what are you gonna tell someone who has interest in this and wants to help out? Like, what's the first step?
I would say, first of all, it's great that you would, you have that desire. And that's the first step, is the desire and the passion about really making a difference. I think the second thing is, on your college campus, I think you have to go to your leaders on your campus, those administrators, and really, because they serve at the pleasure of you. And sometimes we have it twisted around thinking that you serve us, but we serve you. And so I'm not sure the structure here, if it's different than ours, but you have a provost and you have academic VPs of certain divisions, like your student services, who are responsible for your health center and your campus rec, or whatever your health and medical kind of focus on campus. You also have campus organizations like your health clubs, your sororities and your fraternities, your different groups on campus that do things. All of those things have an impact, and if you don't have one of those types of organizations, start one. It's very simple on campus to start a campus organizations that's focused on just health in general. If you think that someone's going to balk about HIV, keep that under the radar and just say that you're focused on health issues on campus, and that way you don't incite a riot when you use the word HIV. There are ways to kind of stay under the radar and having that passion, and then talk to other people that are like yourself that have that interest in getting things started on campus. And you should be doing something. I think the more you can saturate, something in research that we call saturation, when we do qualitative work, where we saturate, and we want to saturate, and if we don't, starts to overflow and we get nothing new, then we know we've reached saturation. So just saturate every month. Have something on your campus, that you're here related to HIV prevention and awareness, and not just HIV, but STDs, because that number that Marlene gave, it is true on every college campus, probably in the United States. At U of H and at TSU, we like to get chlamydia and we pass it around. Okay, so don't just focus on HIV, focus on STDs, because that is something that is very prevalent. A lot of times people come to college, it's their debut, this is their sexual debut, because they feel safe, they feel nobody's going to know them, you can't really do that. It's the same thing with coming out. People come out in college more than they come out in high school, because high school is not safe to come out because you're with people who are so much like you. But when you get to college, it's so diverse, you can kind of be who you want to be. So if you can keep it in the news, keep it in the forefront, in front of people's, and your peers and your colleagues your age, and be the leader, they'll listen to you before they listen to me. So, you can do a lot of opportunities.
I think also, though, there is that need to go outside of this community. There are a lot of volunteerism that you can do with some of these groups that have been listed here today. I think that's the other thing, that you have to be careful that you just don't closet yourself in this kind of, and protect yourself in this kind of community, but to deal with the real world, to be able to volunteer with some of these community organizations, I think would be helpful.
Are you familiar, before Councilmember Edwards speak, are you familiar with HMO, the student organization here on campus? Yeah?
Hi, I'm Susanna Attia, and I'm co-president of Humanitarian Medical Outreach. And we do a lot of AIDS work, but we focus in Kenya, and our focus is really global, and we don't do, our local work really extends to just educating our community about, in other words, Rice, about global health issues. But we have the student, RSVP is our what's the acronym for? well, it's our community service group, Rice Service Volunteer Program, I think. And our health committee, I don't know if they do AIDS work, but we should definitely get some programs started, something annual, some drive or something, maybe get volunteers out to AIDS hospice here in Houston, or Houston Coalition for AIDS or something. But so I'll bring that up more in my meetings.
Okay, Councilmember Edwards.
I would say I would like to make two suggestions to you, and one is based on Booker T. Washington's statement of drop your buckets where you are. That is, influence those who are around you. Find an area that you're already involved in. If you're involved in sports, take the public health message to the sports community. Whatever community that you are involved in and with, that where your passion is, do that work there. Sometimes it's easier. You know what people's hot buttons are. You know what would be of importance to them, and how that would relate to the issue of health or whatever the issue is. The other thing is Gandhi's be the change you want to see in the world. It's not always about telling people what they need to do. And I think that's one of the problems that we get with our children. They feel like we're preaching to them. But sometimes just being that example for them, and how your life is fulfilled because of how your lifestyle is, and that type of thing. But to show the example, be the example of what you're trying to tell people that they need to be doing. And thirdly, join. If you're passionate in sports, join a women's or youth sports organization, and make sure that that's always a part of it. If it's music. If it's arts, Rick Lowe was very catalytic and very instrumental with community art with us when we first started trying to get the HIV message across. So whatever your passion is, take your passion and couple that with the information that you're trying to get out. And I think that'll be easier and more effective for you, but to also live that life. Don't just talk about it, as the kids say, or y'all say, be about it.
Okay, quickly, maybe all three of you can ask your questions, and then they can respond, because we need to wrap this up.
Actually, I just had a quick practical question. My name is Derek Hicks. I'm a doctoral student in religious studies, and also part vocation associate minister at a church here, and work with Reverend Lawson on several advocacy issues. But I also have a 3-year-old daughter, and one thing that Dr. Foreman mentioned was education early, and in terms of sexuality. And so I just wanted to know just if you can expand just a bit on some of those ways that, because I find that we're constantly trying to tell our daughter certain things so that she understands, no touching here, this is what's appropriate. But to what extent do we share certain information, and what are the resources also is the second part of the question. What are the resources out there that might help me so that we can convey appropriate material and information and advice to our 3.5-year-old daughter?
Well, there are resources out there for parents, and I'd be happy to kind of talk with you afterwards if to get you some of that information on, things that you can do. But I think for a 3-year-old, for example, I think children are always giving you clues and information as to what they know and what they want to know. And so the best thing to do is don't bombard them with information that you think they want to know. Most of the time they will tell you what it is that they want to know. And if you really are, observing your child in terms of their maturation and their development, you will notice a change in them. Even a 2- and 3-year-old, whereas maybe, for example, they would allow you to come into the restroom with them, whether it be girl or boy, they change that. And you may already be experiencing that. A 3-year-old now is starting to be, it's a girl being very private with her, and a boy will too start to become very private with things that you've been potty training with. And so that's an indication to you that they now realize that what makes them a boy or a girl is something that is a private matter. So I always tell parents to pick up on those cues and be sensitive to those cues. It's not rocket science, really. It's just kind of, looking and being observant of your child, and then offering information as the child seeks the information. They will come to you and seizing every teachable moment. When it's a moment comes up or something comes up, seize that moment. But then you don't have to give a lot of information, just in bits and pieces, and especially when they're younger. It's more about things like their body. That it's your body, it's private, you don't do that in public, go get dressed in the other room, stop walking around without a shirt, start to really kind of, treat your body as it is something sacred for you. And I think as you go through different levels, Councilmember Edwards mentioned this too, and I'm a big advocate of this, the nutrition of children has now dictated early development of those secondary sex characteristics, and so a girl that is 10 now looks like she's 22. And so your daughter is going to, if she's eating some of the food, is going to experience certain things earlier, hormonal shifts and imbalances, and so that's going to necessitate you having to talk about some things that maybe my parents didn't have to discuss until a little bit later. So it's not rocket science. I think observing, observation, and then just kind of knowing the information and feeding off of what the child is telling you they want to know, and just leaving it there. And then there will come a time when you have that discussion and say, okay, this is what you really need to know. Yeah.
Very quickly, 2 quick questions, and then we'll wrap it up. Okay. Okay.
Hi, my name is Jessica Mays, and I'm here today as a representative from KPFT, local news, 90.1 FM. And I just wanted to, my professional life, I work for Planned Parenthood, and they do a lot of education outreach for church groups and for parents and for student groups as well, so just FYI. But I was recently at an event where they were showing a film by Advocates for Youth, which is a really great group, and they do a lot of really great things. But they went to Europe, and this might be a Eurocentric perspective, but they went to Europe last summer and did this really great report on the public health situations in Germany, France, and the Netherlands, where HIV risks and STI risks and teen pregnancy risks were much lower than the States. Like the States had, 70,000 cases in teens, or it was 12,000 in the Netherlands or something last year. So, but their whole public, and I was reminded by Alan Barrett's talk about the German commercial, but their whole public health attitude, I mean, the public health is funded by the government. The ministers of health approve these commercials about condoms so that kids, they empower teenagers with the information and the respect and the responsibility that they deserve to say that you are perfectly capable of making informed decisions for yourselves. And they're having sex later than American teens in those 3 countries. So they're called Advocates for Youth. And I think it's a really interesting perspective at how we as Americans, and we especially in Texas, aren't addressing public health needs in a respectful way that gives teens the right information they need. And I think that's a lot of evangelical stuff as well, perhaps. But I just wondered maybe, I don't know, I just wanted to bring that up.
Thank you very much. I mean, if any of our panelists has something to say about that, they can. If not, then we will, wrap it up. Yes. Interdenominational Theological Seminary.
Yeah, ITC in Atlanta, they have a wonderful program called Affirming a Future with Hope, and it's educating the Christian community. And they start with the child by saying you're creating God's image and your body is a temple. That's the simple talk that you start with a baby. Let them know who they are and whose image they're creating in. And it's a wonderful, if you can get hold of that material, it helps from the cradle to the crib.
To the tomb. From the womb to the tomb.
So anyway, I went through that program, and it deals with from the babies up, and just a simple letting them know they're creating God's image and their body is a temple. I do a lot of education toward youth and babies about just guarding the temple from everything, just guarding the temple, and they understand it. They're like, oh, I'm a temple.
Okay, would you please join me in thanking our distinguished panelists? And, just one more thing.
One quick thing, especially to the young dad out there, dad of the young person. One of the lessons that I learned too late for my children was to encourage them about being a temple, but then for them to celebrate their body and that nothing in your body is nasty. And I think that that's one of the first things that when children pick up that, ooh, that's nasty, then that puts a whole connotation on everything else you teach them. So if you can help your young daughter to know that her body is a temple and it is special and she needs to celebrate and protect it, then all that other stuff, it'll be a lot easier for her to understand.
Yeah. Thank you very much. Okay, that'll be the last comment.
You know, just advocacy. If you cannot advocate for the people that you're serving, then you don't need to be serving them. Because the funds are there, people are there, they are waiting to hear from us what we need. So we must put that information out. We have to get to our legislators. You have to get to the table. And the only way we're going to help our people is by going after the funding and telling them that this is what is needed and this is how we're going to do it. Right. So let us work with our elected officials and let us advocate for our people.
One final thing, I think nobody is going to do that, but we have to recognize the hard work that Mark has put in bringing this together. If you guys want to know where I stand, I think that HIV/AIDS is probably the most devastating thing that might touch the human community. I see the burden in Africa every time I go back. We all need to work together like our leaders have suggested this afternoon. The resources are there. We can work with our local elected officials, state, national, United Nations. If we are not careful as humankind, like someone has said, HIV/AIDS will define us. And I think we ought to be able to help write that definition, and we can do so by working together. And thank you so much, Mark, for focusing on a very important issue in our community. Over to you.
I'll just be very brief. Thank you, panelists, all of you, for coming today. Those who couldn't make it, unfortunately, had to attend some funerals today. But this turned out wonderful. The one goal that I had was that people who are community leaders, people who are politicians, and people who are public health workers could come together and have a discussion, and that's happened. I have all of your contact information, so please can use me as a resource. If you remember somebody who you spoke to today and you didn't exchange phone numbers, you didn't exchange emails, just call me or email me, and I can pass that along. Yeah, thank you all very much for coming.